If you've ever found yourself struggling to get a great night of sleep, you are not alone. Sleep issues can impact our health and our well-being in significant ways and are very common. In this video, we'll explore when it's time to see a sleep physician and discuss the 6 common sleep disorders that physicians who specialize in sleep medicine can help you with. Hi, I'm Dr. Val, an integrative sleep medicine physician and women's sleep expert. So let's dive into these 6 medical sleep conditions. The first of which is obstructive sleep apnea. Yes, OSA, something I love to talk about because I see it every single day. Probably 80%, 90% of my day is talking about obstructive sleep apnea, and I still enjoy it. The reason for this, it's so common. 1 in 5 adults have it. And the biggest thing that I worry about and I get really concerned is that up to 90% of women who have it are undiagnosed. There's a lot of reasons for this. Some of the common reasons is that the typical signs and symptoms such as snoring, gasping, or choking aren't always seen in women, right? You don't have to snore to have sleep apnea. Sometimes women present with just having a hard time staying asleep, maybe more vivid dreams or nightmares, headaches in the morning, mood disturbance, or insomnia. And it's no wonder if you tell your doctor some of these symptoms, you may not be referred to get a sleep apnea test. And that's a lot of what sleep physicians do. My fellowship was comprised of mainly seeing patients, reading sleep studies, and then diagnosing and treating sleep apnea. And it's what we do day in and day out. So if you've already had a diagnosis of sleep apnea, seeing a sleep doctor certainly can help because we can troubleshoot any issues with your mask, the pressure settings, if you have a dry throat. A lot of things can be done to help make the machine more comfortable for you. And another thing that sleep doctors can do is discuss alternative options. If you aren't interested in using your machine, or maybe you've tried it and it's just not for you, we can see what else is available that may work to treat your obstructive sleep apnea. Another condition that sleep physicians treat is insomnia. Chronic insomnia is a condition that happens if you're having difficulty either falling asleep, staying asleep, associated with some daytime symptoms such as headache, feeling unwell, and it's been going on for at least 3 days a week, more than 3 months. Less than that time period, we say maybe it's more of acute insomnia, or typically people have difficulty sleeping due to acute stressors. Sleep medicine physicians oftentimes can talk about maybe some sleep strategies. Some are trained in something called cognitive behavioral therapy for insomnia, but not all. Sometimes some just give medications, or some may refer to a therapist if that's indicated. But again, sometimes people have insomnia because they have untreated sleep apnea or a circadian rhythm condition, and that's something the sleep doctor can help identify. A third medical sleep condition that would prompt a visit with a sleep doctor is something called hypersomnia. Hypersomnia just means you're really, really tired even if you're getting enough sleep. So what it looks like for adults is at least 7 hours of sleep. Some of the patients that I work with sleep anywhere between 10 to 12 hours and they're still really, really sleepy. What that makes me think of is seeing if they have the condition called narcolepsy, which is, causing a lot of hypersomnia, or another condition is called idiopathic hypersomnia. And we diagnose these conditions with in-lab sleep tests. A fourth condition that medical sleep doctors treat is parasomnias. What parasomnias are just abnormal movements that happen during sleep. These are sleepwalking, sleep talking, maybe night terrors, or acting out your dreams. And these behaviors can be really disruptive and sometimes even dangerous. If you or your loved one has experienced some of these symptoms, a sleep study may help, because sometimes obstructive sleep apnea, it's what we diagnose in the lab, can trigger these symptoms. Sometimes sleep deprivation can cause them. Parasomnias are more common in youth, especially pre-puberty, and then as they get older, they can grow out of it. A fifth condition that sleep doctors treat pretty regularly is restless leg syndrome. And how this is diagnosed is just clinically asking some questions. If you have a hard time falling asleep because your legs are bothering you, maybe they feel creepy crawly, if they feel like an energy and you gotta wiggle them. Another question to ask is what happens if you're on a long plane ride or in a movie theater and you have to get up and walk around, because sitting for too long can cause the symptoms of restless leg syndrome. And it can keep you from falling asleep. So if this is something that you're experiencing, talk to your doctor about it to see if it's a cause for your sleep disturbance. A sixth condition that sleep doctors can also treat is something called shift work disorder. So if you work non-traditional hours, night shift or rotating shift, and you're feeling really awful, maybe you're not getting enough sleep, it may be affecting your ability to function. It's time to talk to a sleep doctor about it to help really evaluate what's going on, help you come up with some strategies to help normalize your sleep schedule or get as much sleep as possible. And there's also some medications that can help with alertness to help manage a shift work disorder. If you're experiencing any of these sleep issues, please don't hesitate to seek help from a sleep physician. It's really important to get the most accurate diagnosis and treatment so that you can sleep better, because when you sleep better, you feel better and you can live more healthier and productive lives. All right, ladies, thanks so much for watching. Until next time, I'll see you in the next video. If you want to learn more about women's sleep health and whole living, please sign up for our newsletter. The link is below. Bye-bye.